So I'll use the panel in a few different ways. I'll think about it in patients who have what I call neuropsychiatric symptoms. So, it could be in kids, and I've certainly used it in adults as well. So these are people who have either an acute exacerbation or new symptoms that involve the nervous system and the brain. And where I think the Cunningham Panel is useful is really kind of being able to look at the immune response that's happening in the nervous system. And when we see these elevated antibodies in the nervous system, then that is supportive of this process that's going on. And that will help me, come up with a treatment protocol for these patients. So the way I'll look at the test is I'll look at, there are 4 antibodies that we're looking at specifically. These are antibodies to specific, let's say, receptors in the nervous system. And that tells me if there are lots of antibodies, then I get a sense that there's sort of an acute situation happening with the immune system. But there's one marker that's used as well in the test. It's called the CAM kinase. And I'll use that as a way of understanding whether there's some chronicity happening. So if that level is high as well, that tells me that there's maybe an acute on chronic situation. It may tell me if there's just a chronic situation. So I think you can use, and there's data to support this, you can use these different antibodies in these different levels to really understand what may be going on at a deeper level.